Welcome class. Today, we will delve into the fascinating world of biosensors and explore the advancements made in medical nanotechnology. Biosensors play a crucial role in disease detection, biomarker detection, and point-of-care testing. In this lecture, we will cover various topics, including the introduction to biosensors, transducers and signal amplification, selective recognition elements, nanomaterials in biosensing, electrochemical and optical biosensors, lab-on-a-chip devices, wearable biosensors, point-of-care testing biosensors, biosensors for disease detection, biomarker detection, challenges, and future directions in biosensors. So, let's get started with our first topic. Biosensors are analytical devices that combine the recognition elements with a transducer to convert a biological response into an electrical signal. These devices have gained significant attention in the field of healthcare due to their ability to provide real-time information regarding various biological and chemical parameters. Biosensors can be classified into different types based on the transducer used, such as electrochemical, optical, and piezoelectric biosensors. They have applications in healthcare, environmental monitoring, food safety, and drug discovery. Transducers are essential components of biosensors that convert the biological response into measurable signals. They can be categorized into electrical, optical, and mechanical transducers. The electrical transducers, commonly used in biosensors, include potentiometric, amperometric, and impedometric transducers. Signal amplification plays a crucial role in biosensors to enhance the sensitivity and detection limits. Various amplification techniques, such as enzyme amplification, nanoparticle-based amplification, and signal amplification by immunoassay, can be employed in biosensors. Selective recognition elements in biosensors are responsible for specifically binding to the target analyte. Antibodies, enzymes, nucleic acids, aptamers, and molecularly imprinted polymers are commonly used recognition elements. Antibodies offer high specificity, while enzymes provide excellent catalytic activity. Nucleic acids and aptamers can be designed to bind to specific targets, and molecularly imprinted polymers offer easy synthesis and high stability. Nanomaterials have revolutionized the field of biosensing due to their unique properties, such as high surface area, size-dependent properties, and excellent biocompatibility. Various nanomaterials, including metallic nanoparticles, carbon nanotubes, graphene, and quantum dots, have been extensively used in biosensors. They enhance the sensitivity, stability, and selectivity of biosensors, allowing for improved detection of analytes. Electrochemical biosensors are widely used due to their simplicity, high sensitivity, low cost, and rapid response. These biosensors utilize electrochemical reactions to generate a measurable signal. Different types of electrochemical biosensors, including amperometric, potentiometric, and impedometric biosensors, offer different advantages based on their detection principles. Amperometric biosensors rely on the measurement of current, potentiometric biosensors use potential measurements, and impedometric biosensors analyze the impedance changes. Optical biosensors utilize light-based technologies for the detection of target analytes. These biosensors offer advantages such as high sensitivity, real-time monitoring, and non-destructive analysis. Surface plasmon resonance, SPR, surface enhanced Raman scattering, SERS, and fluorescence-based biosensors are prominent examples of optical biosensors. SPR biosensors measure changes in refractive index, SERS biosensors analyze vibrational properties of molecules, and fluorescence-based biosensors rely on emission or quenching of light. Lab-on-a-chip, LOC, devices are incredibly useful tools in the field of medical nanotechnology. These devices combine several analytical functions on a single chip, making them compact and portable. One of the major advantages of LOC devices is that they require only a small amount of sample volume, which is beneficial in many healthcare applications. Additionally, these devices boast high throughput capabilities and provide rapid analysis results. The components of LOC devices typically include microfluidic channels, sensors, and integrated circuitry. These components work together to enable the precise manipulation and analysis of biological samples. By integrating these functions onto a small chip, LOC devices have a wide range of applications. They can be used for point-of-care testing, environmental monitoring, and various bioanalytical research projects. Overall, LOC devices offer a convenient and efficient solution for a multitude of biomedical applications. Their miniaturized scale, portability, and ability to perform multiple functions make them an invaluable tool in the field of medical nanotechnology. Wearable biosensors are gaining popularity as they provide continuous health monitoring without intrusiveness. These biosensors can be embedded in clothing, wristbands, or patches, allowing individuals to track their physiological parameters in real time. They can measure parameters like heart rate, temperature, glucose levels, and respiratory rate, offering valuable insights into an individual's health status. Wearable biosensors have applications in sports medicine, remote patient monitoring, and personalized healthcare. Point-of-care testing biosensors enable rapid and accurate diagnosis at the bedside or in remote locations. These biosensors provide results within minutes, minimizing the need for laboratory analysis. They have significant potential in resource-limited settings, emergency rooms, and ambulances. Point-of-care biosensors can detect various diseases, including infectious diseases, cardiovascular diseases, and cancer, facilitating timely interventions and improving patient outcomes. Biosensors play a crucial role in disease detection by providing rapid, sensitive, and specific identification of disease markers. They can detect biomarkers associated with infectious diseases, cancer, cardiovascular diseases, and neurological disorders, among others. Biosensors offer advantages like early detection, non-invasive testing, and improved patient management. They are integrated with advanced technologies for point-of-care diagnosis and therapeutic monitoring. Biomarkers are measurable indicators of normal or abnormal biological processes, disease progression, or response to therapy. Biosensors have revolutionized biomarker detection by providing precise and real-time measurements of these molecules. They can detect various types of biomarkers, including proteins, nucleic acids, metabolites, and antibodies, aiding in disease diagnosis, prognosis, and treatment monitoring. Biomarker detection using biosensors has contributed to personalized medicine and targeted therapies. Despite the significant advancements in biosensors, there are several challenges that need to be addressed. These challenges include improving sensitivity and selectivity, enhancing biosensor stability, integration with portable devices, and achieving regulatory approvals. Future directions in biosensors include the development of multiplex biosensors, the integration of artificial intelligence and machine learning, and the exploration of novel materials and recognition elements. These developments will further enhance the performance, reliability, and applications of biosensors in healthcare. In conclusion, biosensors have a profound impact on healthcare by enabling rapid, sensitive, and specific detection of various biological and chemical parameters. The integration of medical nanotechnology has further enhanced the capabilities of biosensors, making them indispensable in disease diagnosis, biomarker detection, and point-of-care testing. As we continue to advance in this field, biosensors will play a crucial role in personalized medicine, remote monitoring, and improving patient outcomes. I hope this lecture provided you with valuable insights into the field of biosensors.